After suffering major cardiac events like heart attacks and strokes, a lot of focus goes towards medication and procedure, but a major component of recovery is rehabilitation. While very important to the process, only 8% of patients attended up to 36 sessions of cardiac rehab, which is considered to be a full dose of rehabilitation. That's according to the Division of Heart Disease and Stroke Prevention. Dr. Kumar is on call to help us understand this essential part of making a full recovery. Good morning to you, doctor.
Good morning.
So first things first, what exactly is cardiac rehabilitation and who is it recommended for?
Well, cardiac rehab is a holistic approach to recovering after having a cardiac event. It's comprised of physical activities such as cardio and strength training. And then there's an education piece, which is so important, geared towards lifestyle changes, and finally mindfulness-based stress reduction techniques. And these have been shown over and over to go a long way. Now, who is eligible for this? Patients with chest pain syndromes, patients who have suffered a heart attack, heart failure, or really any procedure on their heart, whether that's bypass surgery, valve surgery, or just a stent placement.
And how much of an impact does this make on recovery for cardiac patients?
Decrease in hospitalization, decrease in recurrent stroke, heart attack, heart failure, and really important, an improvement in quality of life. Now, when people suffer a heart attack or really any kind of cardiac event, we see that patients start to become insecure. They lack that confidence in their health. And cardiac rehab really addresses these issues. It can help people titrate their medications so they're feeling good when they emerge back into regular physical activity. But it also helps alleviate the stress, the anxiety, and the depression that also comes along with having heart disease.
Another major issue is stroke. How does rehab work in that instance?
Well, stroke is really very interesting and very complicated. And the idea behind rehab after stroke really goes with the principle of neuroplasticity. Now, neuroplasticity is the concept that the brain can rewire itself when we're young and as we get older. And so we really try to use this concept in rehabilitating patients with stroke. So if patients have cognitive issues, there's speech therapy, occupational therapy, psychological therapies, and with the use of technology, robotics, virtual reality, investigational therapies. But it's really very fascinating how the brain can rewire itself and kind of bypass those areas that were damaged during a stroke to give people regular function back.
And finally, when someone does go through a major cardiac or neurological event, when should that rehab begin?
Well, for cardiac patients, we like to wait about 4 to 6 weeks. That allows the heart to heal. But in stroke patients, rehabilitation should start within the first 24 to 48 hours. And that's because the neuroplasticity that we just discussed, well, it is exaggerated in those first few weeks and months after stroke. So the faster you get to it, the better your prognosis and the better chance of making a full recovery, and if not, even a greater recovery.
All right, thank you, Dr. Kumar. Good to see you.